Hello, my name is Victoria Smythe, and I'm faculty in the Arthur Labatt Family School of Nursing at Western University. And my role as a researcher takes me into the housing and homelessness domain. Intersectionality it's a really interesting term, I think, because it's been taken up in so many different ways. Its utility for me has been how we examine those kind of social locations that people occupy, such as race, gender, age, ability, etc. And then how those locations intersect with structural forms of oppression. They intersect with each other, but they also intersect with other forms of oppression, more structural in nature or social in nature, such as racism, colonialism, you name it, patriarchy. It is really important. And I think that when you're talking about emancipatory work, which is the work that I try to do, it's difficult to do sometimes. Social change is difficult. When you're talking about social problems and those the issues that people live in the everyday, such as homelessness, you're not going to bring any, I think, meaningful solutions unless you're looking across those domains of oppression. So these factors, these social locations, as you noted. So I think that the thing about intersectionality, it brings into sharp relief those relationships, the relationships between those social locations, and then the intersection of those with structural forces of oppression.
So, hi, I'm Tariq Brown. I'm a licensed clinical social worker. I work at Revive Center as the outreach team lead. Intersectionality is really critical in the work that we do. I think for folks, at least in the Chicago area, predominantly our unhoused community are people of color, predominantly men, predominantly black men with less than a high school education. So I think that there are trends that are facts. There's no getting around that. And I think that our system needs to better accommodate who it's serving. I think that it has a one-size-fits-all kind of like method, even though it's tried to like diversify and make it more selective and more sensitive to certain populations, but it's still missing the mark significantly.
Hi, my name is Andrea LaFleur. I am the Director of Programs at Revive Center for Housing and Healing and an occupational therapist. Double the population experiencing homelessness in Chicago is Black, and we have people that we have historic housing discrimination. We have over a century of racist housing policies that have made that happen. Consistent lack of being able to generate generational wealth, not having the basic needs and support within communities, disinvestment in communities where, again, people were forced to be and forced to live, while other, white counterparts had all the resources and services and supports that they needed. There just has been historic harm done to the community that has led to the racial disparity that we have, particularly present in Chicago.
My name is Bhavna Varma, and I am semi-retired. I retired as the CEO of the United Way in Kingston. And I've worked in nonprofits, mostly with the United Way movement, for over 30 years. But the disproportionate nature of people who are homeless, who are Indigenous, who are marginalized, who are racialized, cannot be ignored. And I think that's part of the reason that the othering becomes easier. And I think it's also with women. We know from the work that our agencies do that 85% of women who are homeless in shelters have been abused before the age of 18. And yet, we don't have solutions that respect women's need for safety and respect and dignity, right? We lump them all into this, not recognizing the significant trauma that a woman experiences through abuse. And what are we doing differently for that? With youth, we did come up with, well, the reason youth are homeless is different from adults, so we need to find a different solution. I think we really need to focus on really segmenting the groups we know are disproportional. Women, people who are indigenous, and people who are Black or biracial. We need to look at that differently, and yet we don't. We don't always offer solutions that respect who they are at the core.
In order to really talk about homelessness and housing, I'm going to give an example from my own work. So in my own work, we conducted a study in the Vancouver area, Vancouver downtown east side, actually, with Indigenous men who were living homeless or near homeless. They definitely had not yet reached housing security. They were mostly living housing insecure. And men, there were three things that really came out of that study. One is the force of discrimination, stigma and discrimination, and what it meant across the dimensions that these men lived. So, for example, racism. Racism was actively an active piece of violence, an everyday piece of violence in these men's lives. Racism, poverty. Living in impossible situations. Also living in terms of the issue of ability, living with multiple intersecting illnesses. So mental illness, sometimes alongside substance use, sometimes alongside HIV, often alongside diabetes. These were Indigenous men who were more prone to diabetes, for example. There were just all these really powerful intersecting forces that then really impacted their ability to be housed. So living with a mental illness, the stigma of mental illness, living with the stigma of being an Indigenous person, and all the discrimination that goes with that. So for me, one of the things that was so striking was how those things really came together. They intersected. It wasn't a cumulative thing. It was really about the differential intersections of each of those forms of oppression that impacted their ability to be housed. So I'll give you the example of methadone maintenance treatment, which loomed large in this study. It was really, most of the people that were in this study actually were on methadone maintenance treatment, at least many were. And what was so interesting about that was that the treatment itself, the MMT, actually constrained people's lives. Just the policies and practices associated with MMT, and I'll give you an example, that is having to have your carries and not being able to take them away from where you lived. So this was particularly problematic for women who had children living in other places and they were unable to see their children. Well, this impacts your well-being, which then impacts your housing and homelessness situation. Mm-hmm. So it was really quite striking. And then people's lives were also then constrained by the things that happened as a consequence of that, which was a lot of depression, a sense of helplessness, hopelessness, despair, etc. Again, compounding the issue of homelessness and housing security. They had very profound effects.
Continuously in homeless services, I experienced the discussions around, well, that person can't perform their daily activities of daily living. That person, if they can't use the bathroom on their own, they can't access shelter. If they can't get up from a mat, or if they need to sit with an incline, they're not permitted to access shelter. That people are stopped at the door, they're stuck living at the train, on the platform, trying to survive, or in encampments, because their body doesn't physically fit the setting that it's designed for, as it's designed.
One of the things that I get this all the time, I feel like I get inferior service because of the color of my skin. One of the things I always hate, I hate this and it really irks me. It happens just about every single time I end up in an emergency department. Their first question is, how much alcohol did you drink? Like, really? I don't come in presenting with issues like, I don't come into the hospital presenting with alcohol issues, but that's always their first question.
Yeah, no, absolutely. If we look at, a person who is Black and a woman, or, identifying with a different sexual orientation, naturally, each of those creates a barrier to being able to access the resources and services they need, or just being treated with basic human dignity. On top of that, with, disability, for example, there's also difference in terms of maybe cultural backgrounds and how people perceive disability, how people are supported, whether or not, disability is, that accessibility is a consideration and a resource. So I think generally, definitely, we do see that the layered, marginalized identities leads to significant impact on participation.
Okay, good morning. My name is Dave Morris. I am a supportive services case manager here at Revive. Well, the stigma of homelessness is a lot of things, and I kind of alluded to it earlier, that you're stupid, you're uneducated, you don't really know how to do things, you weren't trained properly, and it's a stigma that affects. I'm not even sure I can completely answer this question. It's something that stays with you, even years later. It still kind of stays with you because sometimes you feel like, does it emanate from my pores that I had that experience at one certain point in time? Can they really figure it out? Can they see it? And just because sometimes it's like a monkey on your back and you feel like no matter how far you've come, no matter what you've done, to a degree, you always feel like you're still trying to get that monkey off your back. And I think it's because of the stigmatization that sometimes it's kind of like, when you have bad thoughts and bad thoughts are trying to take over and you're having to do mental gymnastics and spiritual gymnastics just to push that stuff down and push it away. That's kind of what the stigma of homelessness does sometimes, is that you just don't you just don't know if you'll really ever rise and be who you feel like you were, or who you feel like you're supposed to be, or who you feel like you will be, because that stigma is still sitting in here somewhere.
I think a lot of landlords don't want to rent to formerly homeless folks, especially on the kind of vouchers that we connect people to. Because they're like, oh, this person has this voucher, so they must have mental health, or they must have substance use, and I don't want that kind of person in my property. Or, you'll be having a coffee meeting with a client out in the community, and you could be completely treated terribly by staff, you and the client. This happened to me in January. I was at a coffee shop with a client, and my client is homeless. He can't shower or wash his clothes in ways that everyone else can, but we got some work done and we were having coffee. And people were complaining about the way he smelled. I'm just like, it doesn't take a rocket scientist to notice that this person is going through something.
One of the things that's ironic is a lot of people who need the services the most are not the ones who may be in a position to vote. They don't pay property taxes. We've actually heard councillors talk about that. Well, that doesn't mean they're less of a resident than anyone else. And so I think how they're being treated is almost like they're not people. They're not our residents. They're not people we should worry about, and they are disposable. And that to me is the harshest thing and the most heart-wrenching thing to think about, that we somehow seem to have, not we as everyone, but a lot of people seem to think that people who are homeless, in poverty, with addictions, are disposable. And that's hard for me, because these are human beings. Each of them came from somewhere, with a family, with a background. They, in a place like Kingston and in the rural areas around Kingston, we probably knew them, right? Like if you've grown up in the city, you probably went to school with some of them. And yet you can harden your heart so that you don't see them as people or contributing members of society. They are. Just by being here, they are members of society.
There are challenges in terms of perception with, well, people of this background, are going to be prioritized for services. People with substance use backgrounds, or people of color, or people of LGBTQ status. But the reality is each of those communities, they are facing significant barriers to accessing services, resources. And it comes from just even the human interaction, that when interacting with a housing provider or a healthcare worker, bias comes right into play. We have unfortunately acknowledge that when bringing in occupational therapy and looking at the barriers to accessing healthcare, we notice that oftentimes it comes from that interaction with a provider who, looks down at them, talks down to them, doesn't acknowledge their own expertise and their experience, treats it very transactional, doesn't really develop that relationship. So all the kind of implicit and sometimes explicit biases that are brought into the system, our community members of every marginalized group, may describe having those experiences. LGBTQ as well, where people are, shelters historically were, discriminatory if someone did not fit a certain gender. Medical respite programs at times are separated by gender. And then we have, of course, the political climate where, that is even further ostracized, and saying that anyone of a diversity background, that is seen as a weakness, not a strength. It's discouraged and it's punished in terms of how we're looking at our resources moving forward.
It is all about dehumanizing, and it works both ways. A lot of times they've come into homelessness as a result of being dehumanized in another way. Like people who are marginalized, who don't have a sense of belonging, they fall into addictions, or their mental health suffers, and so then they fall into homelessness, and then we dehumanize them even more, right? So it's kind of a ongoing pattern. and it's getting more and more, as people are getting more isolated and nuclear and insulated from the outside world. I think people are starting to don't see people as human beings anymore. It's the they and the us. They are homeless. They need to be removed, instead of we are homeless. We need to do something about people.
I think the intersecting identities are really important when you're talking about returning into housing security, because then you become of a different part of a different community, and those stigmas, discrimination follow you. They don't just simply vanish. We live in a society in which stigma and discrimination are profoundly present. And it doesn't matter that you're now housed, you're living in another community in which, that particular society is another microcosm of our social world. And that's the reality of our social world. So it makes it very difficult. The other piece is that people that I worked with in homelessness area were also really socially isolated in many, many ways. So just simply integrating is not that easy. That takes some work, and that takes some support to be able to do that. And people that are now housing secure, let's say, I would say in quotation marks, whatever that means for people, is doesn't necessarily follow that they're now less isolated and now included in some way. So a social exclusion still exists for them for many people. It doesn't just disappear overnight. People still live with their mental illness. People might still be in the midst of substance use and maybe substance use issues. So it's complex. It's not straightforward.
Now, when you start to try to get out in the world, as it were, and talk with people, maybe have social networks and maybe networking and that whole deal, it still goes back to having to get over that question, am I worthy enough? Is this person going to accept me as I am? Or is it going to be a thing where they're going to want to maybe ask questions and try to probe and try to figure out or understand who I am? And so then there's the thought in the back of my head, am I going to slip up and say something which will indicate that I had a year of not being really stable, and then what that looks like going forward when you're trying to socialize with people, and realizing that I had a gap in there. So I wasn't able to, like some people, they get together and they talk about their stories and they talk about how they travel and this and that. And I'm sitting in the space and I would love to contribute to that sort of thing because I like to travel. But for a point there, I did not have that experience. So it's the whole thing of, how am I going to fit in? How am I going to reintegrate back in? And will I ever fully be in the place where I was prior? And those are the things that go through your head. So, integration can be a little tough.
Definitely disability is a component. I think we often see people housed in housing that is not accessible for them. Like this is a first floor apartment, but it has an 8-stair walk up and a person can't get into their home. So they are then punished for not having a phone, not being able to communicate with their case manager, having been given a lease to sign without seeing the apartment, and then being put into an apartment that they physically can't get into. We also have, I've just had people report like, I had to crawl to the bathroom when my legs gave out, and then, just considering like, well, gosh, if we had a wider doorway to get into the bathroom, that would be allowing wheelchair access and preventing that barrier. Occupational therapy really has been given us a lens and a perspective to be able to identify some of those things. But I wonder in spaces that don't have that perspective, how people are living and managing when they don't have those needs identified and properly addressed. When it's a very black and white, you're independent or you're not, you can do this or you can't. And then you're at risk of institutionalization in other formats or just return to homelessness.
I think part of this is also, it's easier to other people when they are of a group or a gender or a race that's easy to marginalize. And I don't think our politicians have woken up to that fact. I think we really need to help politicians understand that these are groups and individuals who have already experienced a lot of marginalization and discrimination. And so we can't just lump it all into, like even with the encampments. Let's look at them differently. Let's look at why a woman might choose to live in a tent in the middle of winter versus going to a shelter. Maybe she doesn't feel safe there. People who are trans, people who are, like there's so many different things happening. And yet we just say one solution, get rid of the tents and everyone should be in a shelter, right? I'm being facetious, but you know what I mean. I don't think one size fits all. And I think we need to remind politicians who are focused on looking differently at these different intersectionalities in our community at a different level. We need them to go down to the level that we're talking about, where people are really need that support and that understanding.
I mean, I guess for me, basically, a lot of the issues I've had in dealing with social services has to do with stereotypes and, things that, people come in with these preconceived notions sometimes too. And not that I blame them, they're human, right? People have their things, but they just need to understand that they have those things and to be aware of them and to, make sure that they find ways to work around that.
Removing NIMBYism out of our vocabulary. I mean, strong communities involve everyone. The whole economic spectrum. I wouldn't want to live in a community that is just all the same. I want to live next to everybody and anyone. So, like, NIMBYism has to go. Like, in Chicago, we have aldermanic privilege, which I think Chicago has like 50 wards and 50 aldermen who are like mini mayors. They're very powerful, and they basically can tell the city that, oh, I'm not going to have this affordable housing project in this area because my constituents don't want it. So I think, at least for Chicago, getting rid of aldermanic privilege, getting rid of NIMBYism, eliminating the red tape.
One of the things I learned early on, yes, there's stigma, yes, there's prejudice. I personally find it's hard to fight that. So I'm not going to fight the prejudice or the stigma you might have. You can think what you like, but don't act on it. So what I try to focus in is not changing people's minds. It's the actions and the words that hurt that I try to impact. And I learned that long ago as a person who's brown in this country. People can think what they like. They may not want me here. I'm here. And so what I try to do is think what you like, but if you do something that's going to hurt me, I am going to respond.
I think the number one thing is you just treat people as people. You treat them as you would treat a family member, who's in your household that you grew up with. There's no stigma or anything like that. There's just someone that so you treat them as human beings should be treated, with dignity, with respect, and understanding that no matter where they've been, things have gotten better, things will get better. And also you have the realization that anybody at any time could be in a homeless situation. So having that groundedness, that modesty, that soberness of life, and understanding how life is and what it could be, sometimes positively or negatively, no judgments, and just treating them as you would treat anybody. I know it may sound cliche, but that's what you would do. Treat them like you would treat your mother. I'll do it like that. That's the one that works for me.